I'm Dr. Andrew Cooper, board-certified orthopedic surgeon, specializing in hip and knee replacements. Arthritis is a condition that afflicts millions of Americans. It's certainly something that can affect all parts of the body, but pertinent to what I treat is hip and knee arthritis. It's something that is growing as we become more active, and it's certainly something that tends to increase with time as we age. There's a lot of treatments that we can treat arthritis, including non-operative methods that we will talk about, but certainly one of the mainstay treatments for end-stage arthritis is hip and knee replacements. The four most common reasons people get a hip and knee replacement are degenerative arthritis, there is rheumatoid arthritis, post-traumatic arthritis, which as it sounds is arthritis that develops after an injury, and then avascular necrosis, which is a somewhat more unusual condition that afflicts somewhat younger people where blood supply is compromised to the hip and knee. Osteoarthritis is the most common cause for hip and knee replacements. It's a condition that tends to be more degenerative. It can run in families and often deteriorates with time. Rheumatoid arthritis is more of a systemic condition that causes arthritis in multiple joints. This also can run in families, but fortunately with medical advancements, we've been able to forego hip and knee replacements much more commonly than we used to be able to due to the advent of better medications. Post-traumatic arthritis is a condition that, as it sounds, occurs after an injury. Often with injuries, as well as it's been treated, can often lead to later problems. Even despite a traumatic injury, this can often affect the surface of the hip and the knee, and then later in life this could start causing pain related to arthritic condition. Avascular necrosis is a condition that's somewhat more unusual but can afflict more younger patients with hip and knee problems. The blood supply is very important to the hip and knee, and sometimes the blood supply is compromised for a lot of reasons. Certainly the end stage problem is once the blood supply is compromised to the hip and knee, it can lead to a problem where you need a hip and knee replacement. Hip and knee arthritis often ends with pain. Certainly there's a lot of lifestyle things that can be affected, and most patients come to my office because of certain restrictions in their lifestyle. Certain restrictions such as increased stiffness in their hip and knee that's affecting their activities of daily living, to certain sports that they're unable to play, to even walking. But the end stage result is often pain and disability. Most patients that get a hip and knee replacement do relate to some problem that they can no longer do that they love to be able to do, and that's what leads them to my office for some sort of treatment. The treatment options for arthritis are a myriad, including many non-operative management. For knees especially, there's a lot of treatments that can be performed. Physical therapy and strengthening is important. There's a lot of different injections, including steroid shots to viscosupplementation. There's anti-inflammatories such as Tylenol or Advil, and then there's a multivitamin sometimes we try as well. This can be tried in both the hip and the knee. Only after conservative management is attempted and you're still having disability is surgical management discussed. So if you start having pain in your hip and your knee, seeking a physician is probably advisable. A lot of patients are reluctant to see a physician because they're fearful of surgery, but it's very important to remember that there's a lot of treatments that can be performed other than surgery. So if you're having pain in your hip and your knee that seems to persist, you should probably seek attention.